Over 100,000 Los Angeles residents have been evacuated. At least 25 people who have died as a result of these wildfires, and we have tens of thousands of buildings that have been flattened with only ashes left in their wake. My heart goes out to the people that are affected by this travesty. Today, we're going to be breaking down a lot of the different public health implications that are a result of the wildfires that we're seeing, and just dig into a little bit of why we're seeing an increase in frequency and intensity of these wildfires. For those of you who don't know me, my name is Dr. Bernice, and I am a board-certified emergency medicine physician. I also have subspecialty training in emergency medical services, which encompasses pre-hospital medicine, healthcare outside of the hospital, and disaster medicine. And I have a master's in public policy from the Harvard Kennedy School of Government. We're going to be talking about some of the short-term, the medium-term, and the long-term public health consequences that happen with these out-of-control fires that we continue to see. We're going to start with the immediate health impacts that we see in the setting of these wildfires. The first thing that probably comes to mind are the burn injuries and the literal physical trauma that you could get from them. So physical from the burns themselves, or physical from structures that are collapsing and harming people in the midst of the fire. The next immediate term effect that you see are respiratory conditions. Anybody that you know who may be in the setting of these fires right now will tell you that if you go outside, breathing becomes immediately difficult. And this is especially devastating for really vulnerable populations, including pregnant women, people who suffer from asthma or COPD or other respiratory conditions, young people, and very elderly people. And especially those who are unhoused, who have nowhere to escape to and are constantly being exposed to these effects. And then the next thing that you see are immediate evacuation effects, the immediate term stress that you get from the fact that you've lost your house and now you have to go find somewhere else to go. People who have really serious health effects, perhaps people who need oxygen tanks, or people who are on dialysis, or people who have other durable medical equipment that they need. When you are forced to evacuate without any warning, it can be extremely devastating, because carrying this type of heavy medical equipment can be very difficult, but your life literally depends on it. So you're trying to find cars or vehicles where you can place your oxygen tank, or where you can bring your medication that needs to be refrigerated, or you can do whatever you need to do in order to literally save your life, and that can be extremely stressful, but also some people may not be able to. The next thing we'll talk about is the short-term effects. These are the days to weeks after a wildfire occurs. You might start seeing really severe effects from untreated medical conditions. Healthcare facilities can become overwhelmed, which cause delays in healthcare for people who need immediate care, which increases stress of the providers themselves, increases the stress of people who are trying to transport people to the hospital, but most importantly, it increases the actual physical harm that people experience because they're not able to get healthcare in a timely manner. On top of that, because a lot of people lose their homes in the setting of a wildfire, you get an extreme stretching of the resources that exist in things like homeless shelters. And once you get overcrowding in homeless shelters, you have an increase in things like respiratory diseases, especially a time like right now where we have such a surge in RSV and flu, even COVID. It can be really, really difficult to control and contain those type of respiratory outbreaks. We also have an increase in norovirus, vomiting, diarrheal type of disease. When you get this many people cramped together in a homeless shelter, it can be really, really difficult to contain those type of contagious diseases. So now the medium-term health effects that we see, this is from the weeks to months after a wildfire occurs. One thing that we see is a big uptick in this mental health stress, particularly in children and families. Just trying to pick up the pieces of their life can be extremely strenuous. We also see an increase in food and water insecurity. As you can imagine, when a wildfire comes through and completely devastates an entire region, places like farms, places that have livestock, places that provide food and nourishment to communities, oftentimes are also affected. So the supply chain for food gets really badly affected, and areas that are controlling the cleanliness and the safety of water also can get affected. And many times the contaminants that come from the fire can leak into the water supply and make water less reliable. So this also has so many health effects because we know that food insecurity and water insecurity lead to tremendous health impacts over time. Now to discuss the long-term health effects that you see in wildfires. And this is particularly the months to years after a wildfire occurs. It's important to note that wildfires, even when the actual fire is out, the impacts that are lingering in the air can sometimes last for weeks to months afterward. So people who are chronically being exposed to those types of effects can then have further worsening of their underlying condition. So maybe they had just a mild version of COPD. Some of these people may advance to severe versions. And people who have cardiovascular issues and those sorts of things have also been shown to have worsening of their conditions in the setting of prolonged smoke exposure and in the setting of prolonged stress as a result of the effects of a wildfire. Another thing that may not come to mind immediately is that you can have an increase in vector-borne illnesses. You have profound effects on the climate of the area that is being affected. As a result of the shifting temperature patterns of a region, you have different mosquitoes and infectious diseases that can move to certain areas that perhaps historically have not been affected by those diseases. And so then it becomes important for us to keep up with those types of trends so that we have the appropriate treatments and capacity to manage those new diseases reaching areas that it has never reached before. And then the long-term effects of houselessness and economic instability are tremendous. And it's really important to know that a lot of these effects are the worst in lower income and insecurely housed communities. We're seeing right now that a lot of the areas of Los Angeles are actually, for the most part, higher income, but you still have people who may not have as much economic underpinning who are still existing within these regions. And what you're going to find is that a lot of times those are going to be the people that are more affected. The elderly people, the people who are not able to be as mobile, those people are going to be a lot more severely impacted. For example, after one of the wildfires that occurred in California in 2018, 90% of those who were displaced and were low income were not able to rehouse themselves within a whole year after the fire, which is extremely devastating. I've seen firsthand working in the emergency department. A couple of years ago, there was a really terrible wildfire that affected Canada, and those effects moved down to the United States. Literally hundreds of miles away, we felt the effects. And I remember whenever it started to affect the area that I was treating, and I saw literally overnight an increase in the number of people who came in with asthma exacerbations, and an especially bad impact on those people who were unable to find safe places to hide and not be so affected by the effects in the air. So these things really do not affect everybody equally. The question is, why is it that we're seeing an increase in frequency, intensity, and an increase in difficulty in controlling the wildfires that are affecting the world? And it really comes down to a few things. We're gonna start off with something called the climate feedback loop. It starts with an increase in the emissions of carbon dioxide into the air. A lot of us probably are already familiar with the idea that when greenhouse gases are emitted into the air, it destroys our ozone and our protection from the sun's direct rays onto the earth. The increase in carbon emissions can come from different things, of course, from industrial production, different human behaviors, emissions from transportation vehicles, etc. The reason that this becomes a loop is that wildfires themselves increase the emissions of carbon dioxide into the air. And so then what does that mean? Once we have this excess carbon dioxide in the air, we have the destruction of our ozone layer, then we have unfettered access of the sun's rays onto the earth, we see an increase in the temperature of the earth that we're experiencing. The consequences of these increased temperatures is that we have more dry, arid conditions on the earth. These drier conditions are just ready for ignition. 2024 in California was an extremely dry year, significantly decreased levels of rainfall, and the summer of 2024 was one of the hottest in recent history. So all of those things coming together create what we call a tinderbox effect. And a tinderbox just means that it is extremely flammable. And that's what we saw this week. It's actually insane. I myself was in Los Angeles a couple of days ago visiting friends, and we were having a great time. There was just no way that we could have known what was to come. Literally the day that I was leaving, we noticed that the winds were absolutely out of control. Everything was being blown down. A tree fell on a car right in front of us, and it was absolutely horrifying. And these were a result of something called the Santa Ana winds, which is something that we see very frequently in California. But you can imagine, you have these winds that are happening. You have the dry, arid conditions that are happening. We have the increase in temperatures, and then all it takes is something simple. And at this point, my understanding is that we don't know the exact thing that triggered this particular fire. Sometimes it can be an accident. It can be something as simple as a match that went awry. It can be a lightning strike. It can be a multitude of things that triggers the fire. But once you have dry, arid conditions, as well as significant winds, that fire becomes an absolute nightmare to control. From the perspective of somebody who works as an emergency medicine physician, the impacts of this cannot be overstated. What can we do about all of this? This is extremely overwhelming. From the short-term perspective, it's probably a good idea, especially if you live in an area that is really prone to fires, to make an emergency kit. And this really needs to include masks, so that whenever you are forced to go outside and be exposed to the effects of the smoke and all of those sorts of things, you are able to protect yourself. You also want to have water and non-perishable foods in there so that you are able to last for at least a few days. You want to stay up to date using your local emergency notification software, and it might vary depending on what city you are in. That will tell you about the areas that you need to avoid and the levels of the air quality in different regions. And then you're of course going to want to make sure that you have enough of your own medical equipment. So if you have medications that you need to stay safe, if you have medical equipment that you need, make sure that you're able to pack those things up in a really meaningful, quick way in the case of needing to evacuate. The other thing is having an evacuation plan. Where are you gonna go? How are you gonna get there? Literally sitting down before something scary like this happens and really talking through what that's gonna look like so that when the time comes, you're able to just jump up and act. The other thing that you can do is just build resilience within your own community. So educate yourself on, are there places where you can go get emergency supplies if you're ever in a situation where you're forced to evacuate? Some cities actually have repositories where you can go rent air purifiers, or you can go rent certain medical equipment, or are there resources in your community where you can go borrow certain supplies, especially if you're one of those people that may not have access to them. Talking with your healthcare provider, trying to understand what are your own personal vulnerabilities and what do you need to be careful not to expose yourself to in the setting of acute emergencies. And then if you are one of the privileged people who maybe has more money, more resources, is able to sustain yourself in some of these higher risk conditions, consider going and volunteering at your local homeless shelter or your local food shelter, or at least providing money and resources so that those places can continue to exist and continue to operate when we have such acute events like this happening. And then from the longest term perspective, it's moments like this that remind us that once we go back to normal, we really have to push for climate forward policies. These things have become very politicized, and it's really unfortunate because there's nothing more bipartisan than the air that we breathe. There's nothing more bipartisan than the need to have a home. And it's just unfortunate that some of these things have been cut across party lines when they affect everybody in major ways. So just pushing for things that are going to make it so that we have access to affordable housing, that we have access to homeless shelters for moments like this of acute need, that we are doing things that are not going to continue to worsen the carbon dioxide effects that we're seeing in our world. All of these things are just really, really critical for ourselves and for our progeny, for our kids, for our grandkids, so that we can continue to have and enjoy this life, this society, and this world that we all live in. This is just a lot. I think for myself as an emergency physician, my heart just goes out to the emergency providers that are going out while everybody is being told to run away. We have firefighters, we have paramedics, we have healthcare personnel that are still showing up to work and running towards the fire, running towards the literal fire. And these are my colleagues. These are people who I have so much love and respect for. So I just know that you guys are doing literally the Lord's work, and I give you so many props. I give you so much love and support. You guys are doing amazing work, and just, you are so, so appreciated. And just for everybody who is affected and everybody who's just scared about everything that's going on, there is so much to process, and the unfortunate reality is it's looking like we're gonna see these things happen more often. But I think if we're armed with the information of what are the risks that we need to look out for, how can we empower ourselves, protect our families, and make sure that we are able and ready to stand up and get through it when things like this happen, we'll be much better for it. So I wish this wasn't happening, but I hope that this video gave you a little bit more context in terms of why we're seeing what we're seeing, what impacts we can expect to see, and then how we can better arm ourselves to get through this, get to the other side, and hopefully not see it affect us so badly in the future. For anybody who's new here, I really appreciate you getting to this point in the video. It really means a lot. It is definitely in my vision board to produce more educational content and more content that improves your guys' lives and optimizes our own personal health and wellness every day. So subscribe, come back to this channel, share this video, and join the community. I'm really looking forward to everything else that we're gonna have moving forward, and I appreciate you all. Bye.